one were dying of breast cancer. Wouldn't you want to know that the best possible treatment currently available was being used? And wouldn't you want to know that this treatment had been previously thoroughly analyzed so as to ensure it would yield optimal results? What I'm not talking about today is some novel treatment or therapy that's never been proven to work. I'm not talking about some pie-in-the-sky idea without any data supporting it. What I'm talking about today is the most effective drugs we currently use in treating breast cancer. Examining them to make sure they are actually yielding optimal results for patients. Herein lies now an interesting problem. Today in the clinic, breast cancer patients receive chemotherapy and steroids. The chemotherapy drug I study is called Taxol. Taxol is perhaps the most effective anti-cancer drug developed over the past 50 years. Taxol kills cancer cells. Unfortunately, it also produces many unwanted side effects, effects like nausea, vomiting, hypersensitivity. So to deal with these, doctors also give the patient steroids to counteract the unwanted side effects. And herein lies an interesting problem. No one has ever taken the time in a clinical trial sense to ask, if these steroids can block the unwanted side effects of Taxol, what, if any, impact might they have on the desired effects of Taxol? In my research, I take breast cancer cells and I treat them with these steroids to see what impact the steroids are having on Taxol. And I have found an alarming result. Namely, the steroids we are currently giving breast cancer patients in the clinic actually enhance negative characteristics of cancer. You see, cancer cells divide and divide continuously, even without any signals telling them to do so. This is why they form tumors. Cancer cells also are able to break through existing boundaries into new tissues where they don't belong. Cancer cells, once they've invaded new tissues, also move. They migrate throughout the body. We call it metastasis. And cancer cells have innate protection, defense mechanisms, making them resistant to the very drugs we want to treat them with. I have found in my research that the steroids we're giving breast cancer patients in the clinic do all of these things. They speed up cell division, they enhance invasion, they protect against Taxol that we treat with, and they actually make these cells resistant. In conclusion, the significance of all this is that while we have developed a very effective anti-cancer drug in Taxol, we may actually be inhibiting it from doing its job through use of these steroids. You see, these steroids make the patient more comfortable. I don't believe that the choice needs to be the lesser of two evils. Would you like to be comfortable, or would you like to be cured? I believe that through research, both are very much possible. The question my research asks is, could we do better with the drugs we currently have in hand? And the answer, I believe, is yes, we can. And my research shows that to be true. Thank you very much.